As America rushes to meet President Biden's goal of vaccinating more than 70% of the country by July 4th, a debate is heating up amongst experts about will this get us to herd immunity and how much herd immunity matters for us to declare we have conquered the coronavirus. According to calculations, 60% of the US population are immune to COVID. But is this enough to return us to normal? Ditch the mask and social distancing, and fully reopen businesses around the country. Today, we are asking the experts, all coming up next.
Live from Los Angeles, this is the Special Report.
Across the country, states are relaxing their restrictions on social distancing, mask wearing both inside and outdoors, and are passing laws that forbid local elected officials from passing any ordinances to the contrary. And 2 weeks ago, the governor of Florida declared the state's COVID-19 emergency over. He even signed an executive order and a bill that prevents businesses, schools, and government entities across the state from asking anyone to provide proof of a COVID vaccination. The governor is essentially stating that COVID is over in the state of Florida. In announcing the new law, he went as far as to say people want to be happy living in Florida. Several local Florida mayors are livid, saying that residents are still in danger. These officials say the virus is still with us and local government ought to be able to require indoor mask wearing when appropriate. Florida and states who have enacted similar laws say it's about protecting individual liberties. Is it really about individual liberties, or is this irresponsible conduct that ignores the science? Here for my leadoff panel are Diana Barrett and Amy Watson. Amy is a returning guest to the show. She's a preschool teacher, COVID survivor, and founder of Long Haul COVID Fighters. And welcome for her debut appearance on the show, Diana Barrett. She is a COVID survivor and founder of Survivor Corps. This grassroots organization of survivors helps to get survivors of COVID to participate in medical and scientific research. Good morning and welcome to the show, Amy and Diana. I should say welcome back to you, Amy, because you've been with us a couple of times and I always appreciate seeing you. I always got to ask, how are you feeling these days?
Much the same, unfortunately. I wish that my COVID vaccine was the magic cure-all that the media has been touting, that it is just not. So yeah, day 422 of a chronic fever and about 24 other symptoms. So.
Wow. Sorry to hear that, Amy. Always wishing and hoping that, you will get on the other side of this. But what about you, Diana? You're a COVID survivor too. How are you feeling these days? Oh, you have to unmute yourself, Diana.
I have to say that I did not have nearly as rough of a time as Amy and so many of the other long haulers out there. I like to say that I am a better spokesperson on the subject than I am an example. Although I was diagnosed with COVID onset glaucoma, I ended up in the hospital this past February, 11 months after COVID, with a mysterious abscess in my jaw. Still have deep inner ear pain that comes and goes, but again, nothing like what other people are experiencing, which is just absolutely debilitating.
Yeah, I want to ask you, Amy, in particular, I read an article that said there are about 3 million COVID survivors who have been identified as long haulers. And those are people who've had COVID but have these symptoms that don't seem to go away. And in this article, they talked about prescription opioids and how opioids are now being prescribed at alarming rates for long haulers. And there's some concern about addiction, and other side effects related to prescribing opioids. Is that something that you personally have considered, or some of the members in your big survivors group? How is this opioid conversation taking place in those groups?
For me personally, I'm allergic to all opioids and can't take any of them ever, except intravenously for general anesthesia. My anesthesiologists have come up with a good combo that they have documented, but pain relief, unfortunately, is something that we're all grappling with and trying to manage due to the large amounts of inflammation that we have But it's not something that I hear long haulers talking about regularly. I think it's just, connected to the concerns around the opioid epidemic, that we don't want to be putting more patients on opioids than necessary. And so looking at other alternatives for pain relief. I've been working with a pain therapist since last summer who's been incredibly helpful, adding some new tools to my tool belt to manage my chronic pain and chronic fatigue. And he's, that's been an alternative route that's been super helpful for me.
How about you, Diana? Any conversations in your group, Survivors Corps, about people considering opioids, or some who are perhaps even using them to manage their pain?
We also haven't seen a lot of that. We've seen a lot of anti-anxiety medications being given out in absence of an understanding of what's going on, and perhaps look, everybody is anxious these days. I don't mean to take that away, but there is a lot of confusion between symptoms, the long tail sequela symptoms of COVID, and psychological issues and mental health issues. And I think it's very important to make a distinction between mental health issues that are related to all of this and the neurological issues. And I think that one of the unfortunate things, what the opioid issue raises, is just how few answers we have right now. And that's sort of the crux of it. And, we do not want to see doctors throwing opioids or any medicine that is not going to help. We don't need more medicine in the mix. The CDC is about to release some interim clinical guidelines, because right now, look, the medical profession they've been drinking from a fire hose from the beginning, and they are flying blind. This is a novel virus with novel long-term sequela that we have yet to fully understand.
Yeah, I want to ask you, Amy. So I opened the show talking about Florida in particular, but Florida, is following, or is leading, I should say, a lot of other states who have basically said this virus is pretty much over, and all of the emergency orders that were in place last year, they are, dismantling those orders. They are saying go out there without mask into the public, whether it's an outdoor event or, an indoor stadium. We've seen stadiums full of people, in some parts of the country. Do you have any concerns, as someone who is sitting here 200 plus days later with symptoms from COVID, that the country is moving too quickly?
Yeah, 400 plus days later, but absolutely I have concerns. I am shaking my head constantly at every headline, because we are so not out of this. I'm in Multnomah County in Portland, Oregon, and we just moved from extreme risk down a step to high risk. Like, this is not over. We are not reached herd immunity, not even close. Vaccinations have slowed down. That's a huge concern. For me as a teacher, the thought of stepping back into the classroom, and, my students are under 12. They will not have been vaccinated. And I originally believe I became ill from exposure from a student very early in the pandemic. It's a huge concern. Children are not exempt from COVID, and we have to look out for them and advocate for them and their safety, if not our own.
Yeah, I'm glad you brought it up that you are a teacher, Amy, because when I saw this headline from Tucker Carlson, who urged people to call Child Protective Services and to report parents of children wearing masks outdoors. He equated it with some form of child abuse. Now, fortunately, there was immediate backlash, folks calling for him to be fired for that kind of, bullying and spreading of misinformation. But as a teacher, how does it make you feel that on a major network that has, millions and millions of viewers, one of its headline anchors or show host is saying that you should report a parent who puts a mask on a kid's face?
It's absolutely ridiculous. Any parent who loves their child puts them in a car seat and buckles them up when they prepare to drive down the road. If you're going to take your child out into public during a pandemic, of course they should be wearing a mask. They have zero protection. They have no immunity. They don't have a vaccine available. And it's our job as parents and adults to protect them and keep them as safe as possible.
Yeah, like I said, I was glad there was immediate backlash to that. As someone who is a child advocate myself, I was just horrified by those comments, knowing how dangerous it is, not to mention, the confrontations that are happening already over mask wearing, but to encourage people to confront parents, just creating more chaos and the potential for violence. Diana, I do want to ask you though about the CDC guidelines. There seems to be all over the place about mask wearing. And recently there was this controversy about summer camps, and that CDC guidelines saying that kids had to wear masks and be 3 feet apart from each other, socially distanced. And a lot of parents, went ballistic saying, look, it's, 80, 90-degree weather. Kids are going to be sweaty. They're going to be, passing out with masks on in the summer heat. And it's not realistic to expect them to be 3 feet apart at a summer camp. So you have the Tucker Carlsons of the world saying confront parents, and then you have the CDC saying put a mask on kids even when they're outside playing at summer camp. What did you make of the CDC guidelines around summer camp?
As being a parent of 2 summer camp children myself, who did not go to camp last summer because it was not run because they couldn't figure out a way to do it safely, and watching the camps that were able to do it well, and watching how my children's camp is preparing for this summer, there's a better way to do it. And it's not everything is an either or. So if you can put children into cohorts, if they can be masked outdoors, if they're playing soccer, there are activities that are safer than others. And we can't look at things as a black and white issue is, things are either forbidden or not, because there are shades of gray. If you've been vaccinated, you don't necessarily need to be wearing a mask anymore. But if you are in a crowded place where you don't know who's been vaccinated and who hasn't, out of respect, it's the better thing to put on the mask. I am so happy that my good friend Amy here brought up the issue of children getting COVID. I think that as a country, we are being far too relaxed about the idea of our children getting infected, because we do not know what the long-term ramifications on their bodies are. Let me give you my own son's example. He had a very mild case of COVID in January 2020 before we even knew that it was COVID. It was later confirmed by antibodies. I got it totally separately from him in March. But I never would have called him a long haul kid. Yes, does he have stomach aches and headaches from time to time? Yes, but can I say that they're related to COVID for sure? I don't know. That said, 9 months later, he was sitting on the couch watching TV, as a 12-year-old boy does, and one of his front adult teeth fell out spontaneously with no blood loss. Kind of your worst nightmare, right? Your teeth falling out. And that was from vascular damage due to COVID. And we did a poll on Survivor Corps and found that 28% of our members were experiencing new and unusual dental issues. 14% were reporting teeth cracking, crumbling, and falling out. So we can't, just because your child might have a mild case of COVID, of what looks like a mild case, we have no idea what the long-term ramifications on their body is. Look, we initially thought of this as a respiratory disease. We quickly understood that it was a vascular and inflammatory disease, but we will look back on it, I think, also largely as a neurological disease. And we are seeing extreme reports of children and adolescents in particular with psychiatric issues that, again, are neurological. They're medical issues that need to be treated medically, not behaviorally, not with, psychiatric medications, but medically. We're seeing children come out of mild cases of COVID with seizure disorders. The length of symptoms would horrify you. And it seems that these new variants are actually children are much more susceptible. And another thing, when we're talking about opening up, we have to remember that we live in a global community. And all you need to do is look at what's happening in India and now in Sri Lanka and Nepal, and what's happening in Brazil and what's happening in other countries around the world, and realize that we are one flight away from that being us, because all it takes is one wrong breath.
Yeah. And that's a really good point, Diana, about the global nature of this virus, and the fact that it doesn't know boundaries. It doesn't stop at the U.S. boundary or any other, country's boundary. I do want to ask you, Amy, before I get out, there are a lot of people who are not getting vaccinated. And one of the reasons I frequently hear is that people feel like, I don't need to because I've gone for the last 12, 14 months and I haven't gotten COVID. So they feel like their chances are pretty good that they're not going to get it. What advice would you give to someone who's, you know, thinking like that and then using those thoughts to not get vaccinated?
Well, it sounds like they've been lucky until they're not. Like you're only immune if you don't get it. If you get it, then you have COVID. And why would you want to take that risk when you could end up a long hauler? It's not worth it. It's just not. If you could, avoid spreading it to your family, if you can avoid spreading it to people who are immunocompromised and need our community to support them and keeping them safe. I mean, I really struggle with the mindset of, the me first attitude. Getting vaccinated was not a picnic for me. It felt a lot like I had been in a car accident for several weeks after each of my injections. Massive pain, inflammation, aches, chills, fever, well, higher fever than normal. But it's the right and responsible thing to do as a member of our community. And I just think that it's so important that we each do our part for the greater good.
Yeah.
I couldn't agree more. And if I could just add that I am far from an epidemiologist. I am not a doctor. I am not a scientist. But I think that it's a bit of a fool's errand to be talking about chasing herd immunity. We don't know what that number is. We will never know exactly what percentage of our population has been exposed, has been vaccinated, has had a residual, antibodies from previous infection that might or might not last. Remember, I've kept track of my antibodies all the way along. I had the first antibody test given in America on March 28th of 2020. I tracked them through every month. I had positive antibodies only until October. They were gone. And then I got my T cells tested in December and double checked it in January. I was negative for a T cell response to COVID. My husband had a much more mild case than I did. He still had antibodies. He still had a T cell COVID response. From the moment I found that out, I did not leave my house literally until 2 weeks after my second vaccination had kicked in. Nobody knows what their individual immunological profile really is. And I'm happy to say that I just went and got my antibodies checked last week and they are soaring again from the vaccine.
Well, thank you for sharing that, Diane. I think the key takeaway from this is we are all individuals and we're all different, and we don't even know, how our bodies are going to respond to both having the virus as well as the vaccination. So be safe. I think that's the message I want my viewers to take away. Be safe. This virus is not over. Thank you so much for Diana and Amy for sharing your stories. Thank you for being a voice to COVID survivors, and particularly those long haulers, and helping us remember that this virus is not yet over, and we all have an obligation to our families and to each other to try to protect as many people as we possibly can. So again, thank you, Diana, and thank you, Amy. Always good to see you. My next guest is Dr. Amesh Adalja. He is a senior scholar at Johns Hopkins Center for Health. He's been on the show many times as a guest, helping us make sense of all of this from a medical standpoint. Good morning, Dr. Adalja, and welcome back. First question I want to ask you is, are states moving too fast with their reopening? We just heard these two women who are COVID survivors, COVID long haulers. They work with thousands of other COVID survivors, and there's some real fear you heard Amy express about how states are reopening. So tell us from a medical standpoint, are we moving too quickly?
No, I don't think that we're moving too quickly. What we have now is a difference in the pandemic. What we're seeing now are cases decoupled from hospitalizations and deaths because vaccine has been so well rolled out to those high-risk individuals. And that's what flattening the curve was always about, maintaining hospital capacity. So I do think when you have hospitals looking so much better now in May of 2021 than they did in in January of 2021, you have that flexibility. And I do think that the states are moving at the appropriate pace. I would like to see them go a little bit faster and a little bit more aggressive, because we do have enough vaccination now that we're not going to be put into any kind of crisis. So I think you're going to see this on different paces, but I think we're all headed in the right trajectory towards back to some semblance of our pre-pandemic life.
And what about Dr. Adalja, what Diana said about, borders and boundaries and what's happening in India and Brazil and some of these other countries? Should we be worried about the high positivity rates in those other countries and how that might impact the U.S.?
So the impact is not going to be direct. I don't think, because we've already vaccinated so many of our nursing home patients, our elderly populations, that even when you come to those more contagious variants that are spreading in Brazil and in India, the vaccine still stops what matters: serious disease, hospitalization, and death. So to me, I'm not so much worried about those outbreaks impinging on the United States, but I do think that making sure that the pandemic is controlled in all corners of the globe is very important, because the world is going to remain disrupted. And India is also a net vaccine exporter, and we need to get the virus under control there so they can start exporting vaccines to parts of the developing world. But no, I'm not so much worried about those cases impinging on the US, because we've done a really good job of removing the ability of the virus to cause serious disease, hospitalization, and death, because of the way the prioritization scheme was arranged with our vaccine. So we're not going to have the trajectory of India or Brazil. I think that is behind us. It's past us.
And what about, Dr. Adalja, this herd immunity? Again, came up in my earlier conversation with Amy and Diana. It's in the news. Debates over, whether we're going to reach herd immunity, whether it's important that we do reach it at all. Where do you stand on that?
So herd immunity is an important milestone, but it's not the be all and end all, because again, as I've said before, what we've been trying to do is tame this virus. We've been trying to make it unable to put our hospitals into crisis. This is not a virus that was going to be eradicated or eliminated. It doesn't meet those criteria. This was always going to be something that we dealt with. But what we were trying to do is remove its ability to be so dangerous, to be able to cause disease at such a high level. And that's where we're going to get. And if you look at countries that are highly vaccinated, like Israel, they had a precipitous decline in cases when they got to about 40% of their population fully vaccinated. So I think that herd immunity is something to strive for, but if we don't achieve it, and I don't think it's necessary to achieve it, we will still have ended the public health emergency. We still will have made COVID-19 a less fearsome virus, because we vaccinated those high-risk groups that are most likely to have severe consequences of disease.
What about, Dr. Adalja, this kind of looks like a change in what's happening at the CDC around mask wearing. So we know they've relaxed the guidelines as it relates to wearing masks outside. But yesterday, on a lot of the morning shows, the news shows on Sunday morning, there was some conversations about whether there's going to be a change in the CDC guidelines with respect to wearing masks indoors, or being able to not wear them indoors. What do you think that we're going to see a guideline coming down this week, maybe saying that we can take the mask off indoors? And is that safe?
So what we're talking about are fully vaccinated people and their ability to spread the virus. And what the data is showing is that if you're fully vaccinated, you are unlikely to be a spreader of this virus. So what you will likely see is updated public health guidance for what fully vaccinated people can do. And you may see a distinguishing guidance for what vaccinated people can do and what unvaccinated people can do safely in an indoor setting. And I do think that there is data to support the fact that if you're fully vaccinated, you're not going to be a spreader of infection, and you're very unlikely to be infected with the virus. So I do think what we want people to do is see this vaccine as something that's going to allow them to get their lives back. And masks are something that are very contentious. People have a hard time complying with them. And I think the data does show that if you're a fully vaccinated person, your risk to others is very different, and your risk of getting infected is very different. So you might see some change in this guidance from the CDC, and Dr. Fauci sort of alluded to that yesterday.
Yeah, I want to bring in Dr. Emily G. into the conversation. She's a senior economist of health policy at American Progress. Good morning, Dr. G. Thank you for joining us. I wanted to bring you in as an economist because I don't know. I feel like this whole herd immunity conversation in particular, and now the mask wearing conversation, I'm trying to understand, and I think viewers and just the American public is trying to understand, is this about science and medicine, or is this about economics? Because I felt like we spent a lot of time telling this country that we had to get to herd immunity. We had to get to herd immunity, and the vaccination was the way to get there. And now I feel like the goalpost is being moved, and now we're saying, well, that herd immunity thing is important, but it's not so important. But is that because the science is saying it's not so important, or is that because economically, there's this pressure from businesses to open up?
Thanks, Areva. That's a great question. So what I think is important to keep in mind about herd immunity is there's no one magic number that flips a switch. We know that the more vaccination we have, the greater the population immunity is, the less transmission we'll have, which makes it safer. A herd immunity number would depend on a number of things. What other measures are being used besides vaccination, like masking or distancing? It depends on the transmissibility of the variants. It depends on who's already had COVID or who gets vaccinated. That said, we do need to be targeting a high level of vaccination in this country. We see in Israel and the UK that when vaccinations reach about 50 or 60%, the number of cases drops dramatically. We're seeing the same sort of good news come out of California, where a very high percent of the population is vaccinated where you are. And we should be, setting our goal high for the United States. I think just because we can't get to some, herd immunity number, or some people think we can't, doesn't mean we should give up. We have a lot of tools that we should be using that we're not using yet.
But what is, if there is a magic number, what is the magic number that should allow the economy, throughout the country to open up fully? Because I think that's also very confusing. If you go to certain states like Texas, the economy is fully open. I have friends who said they were in Texas and everything was open. In places like California, there's still long lines because there's capacity limits in terms of restaurants and department stores. So when are we going to know it's safe for everything to be open the way it was, in 2019 pre-pandemic?
So Dr. Fauci has said, a herd immunity number would probably be around 70 to 85%. That said, that's not the only number that matters. Local and state leaders also need to be looking at the number of cases to understand the level of transmission in the community. And opening should depend on how immune people are, as well as the likelihood of catching the virus. So, this is not another thing that's an on-off switch. Reopening should be something that is done looking at the numbers in the local area. We can start doing things like taking off masks outdoors already. I expect changes to indoor masking for vaccinated people will be coming up. Capacity constraints can be dialed up or down. There is a real trade-off between the economy. We see that in the jobs numbers, that a lot of people don't have jobs still. But getting that reopening to happen, creating more jobs is going to depend on both the private sector and the public sector taking steps to increase the vaccination rate.
All right, so let me ask you this, Dr. Adalja. Most businesses are not even asking their employees if they've been vaccinated. They believe that's an invasion of their privacy. They're not mandating that individuals be vaccinated. So how will we know it's safe to go to a jam-packed concert indoors or a jam-packed bar or restaurant if we won't even know if the people sitting next to us or even the employees have been vaccinated?
Well, the way that you assure yourself of not being at risk is to get yourself vaccinated, because if you're fully vaccinated, the risk that others pose to you is going to be very, very minimal. So me as a vaccinated person, I've went back to as much of my pre-pandemic life as I can, because I know that even if there are unvaccinated people around me, I'm not going to be at risk for severe consequences of this virus, and I'm unlikely to even be infected because breakthrough infections are extremely rare. 99.93% of people will not get a breakthrough infection. So I think that this is something that you have to remember, that the risk isn't going to be zero. The virus isn't going to go back into bats. It's out there. It's going to be something we deal with as a seasonal respiratory virus. And as I said from the very beginning, that what we were trying to do is flatten the curve, and the curve was being flattened to preserve hospital capacity. Now we're in a position where we've got to teach people how to make risk calculations. And I think for too long during this pandemic, people have kind of taken this abstinence-only approach where they didn't learn how to make risk calculations, didn't learn how to understand which activities are safe, and didn't know how to integrate all that with their own personal risk tolerance. And I think we're gonna suffer for that. And I think now things are getting back to normal. And the best thing that you can do is to get yourself fully vaccinated, so that when you're in those situations, you don't have to worry about someone's vaccination status, because you are protected.
So I imagine, based on what you've said, that you are not in favor of vaccine passports or requiring people to prove that they've been vaccinated, because you're saying if you're vaccinated, it really doesn't matter what the person sitting next to you, what their status is.
Well, I think that private businesses can and should ask people if they're vaccinated and should encourage their employees to be as vaccinated as possible, because the virus is still disruptive. You don't want to have cases. You don't want to have contact tracing at your place of business. And if you're trying to increase capacity and you don't want to have to police unvaccinated and vaccinated people, I think if you, for example, have a big sports stadium and you have a vaccinated only section where you don't really worry about things, that's perfectly fine. So I do think that vaccines, if you're fully vaccinated, the virus is going to treat you very differently. So I think you should be treated very differently. And I think that's what we have to move towards. I think that if we do have vaccine passports, I think that's going to be something temporary until this public health emergency ends. And I think that private businesses are perfectly within their rights to want to cater to vaccinated people differently than the way they do to unvaccinated people. And people should expect that. And I think that this is all part of really demonstrating what the value of this vaccine is. It allows you to get your pre-pandemic life back. So I am in favor of employers mandating this. I think it's going to be easier once the FDA gives this a full licensure, which hopefully will be coming within the next months. But it is going to be something that we want to get as high a vaccine level as possible, and really want to underscore how the vaccine removes the threat of COVID-19 from your personal life.
And just to be clear, Dr. Adalja, I want to make sure, because this applies to me, I'm fully vaccinated. I've been that way for a couple of months. You're saying that a fully vaccinated person can go into, let's say, an office building in a crowded coffee room with 20, 30, of fellow workers, take their mask off and not worry about being infected?
I would not. In most circumstances, I think that would be perfectly safe. I think public health guidance is going to lag. It's going to be that point where eventually the CDC is going to start saying that vaccinated people are not at risk for any of this. But if you look at the data of people who are fully vaccinated, it is extremely rare for them to have a breakthrough infection. There were over 70 million doses given and only 17 million doses given and 5,800 breakthrough infection. So that comes out to like a 0.007% rate of breakthrough infection. And of the ones that were actually consequential, even lower. So I do think that when you're fully vaccinated, it is very hard for you to become infected. And I myself, as a fully vaccinated person, would not worry about anybody infecting me in any ordinary circumstance.
So, Dr. G, let me ask you this about the economy then. So based on what Dr. Adalja is saying, why don't we see more businesses just fully opening? Why do we see businesses? He said he thinks it would be perfectly fine for businesses to say vaccinated people, sit on this side of the restaurant, take your mask off, eat, drink, be merry. Non-vaccinated people, maybe keep your mask on, while you're not eating. Why aren't we seeing more businesses, make those kinds of adjustments so that they can reopen fully?
We're still at the point where we only have 1/3 of the population totally vaccinated. So, we still have a ways to go to get to the point where we can, safely all take off our masks indoors. That said, we are seeing a number of businesses start to, do the sorts of things you're talking about and incentivize vaccination. So we're seeing some sports teams announce they'll have vaccinated only sections at, basketball arenas. Some bars saying they want people to show proof of vaccination or negative tests before people can enter. And I think that's, it's a good way to incentivize vaccination. That said, I think there are some employers that also have a responsibility to ensure people are vaccinated when they deal with unvaccinated people or they're in high-risk settings like meatpacking plants or childcare centers.
Do you think we're going to see employers mandating vaccines in the workplace?
We're seeing that already. We're seeing, I think that one of the leaders has been colleges and universities, which say that students need to be vaccinated for the fall, but that is increasingly also applying to staff and faculty who interact with the students.
Mm-hmm. All right. This is a lot. I think there's so much. I don't know, Dr. Adalja. I just feel like the information is coming so quickly and it feels very confusing to me. And, I'm pretty in that percentage of folks that follow news pretty closely and would be considered pretty smart about how to interpret the news. And I'm having a hard time making sense of this. And I think people aren't feeling what you're saying, that there's this safety even in the vaccine. There's still a lot of fear about going into settings with people who you don't know are vaccinated and feeling as safe. How do we, I'll just ask you this last question, what can we do as a country to reach those people, me included, to make us feel safer in going back and resuming, as you said, our pre-pandemic life?
I think what we have to do is talk to people about the data that these vaccines have been put into hundreds of millions of people. Some countries are very highly vaccinated. And what we're seeing is that you're not getting breakthrough infections. That's what we're worried about. When you go into a crowd, when you're fully vaccinated, you're worried, can I get infected despite being vaccinated? And that's just not happening to a high degree. CDC guidance has been very reactive. They're taking baby steps. They're being very cautious. All these baby steps are in the right direction, but they're still cautious. I think what we want to see from the CDC is to be much more bold, to really sell these vaccines on what they can do. And I think we know, for example, the CDC doesn't recommend you even get tested unless you're symptomatic if you're fully vaccinated. So they really know how effective these vaccines are. And I think we just have to get better at announcing this. I think for too long, as I said, we've been in this kind of abstinence-only approach during this pandemic, where people have been afraid to do certain things, and people have been telling people just refrain from social interaction. And now I think we've got to get people back out there doing things, and I think the vaccines are the tool to do it. And it's just that they've been undersold for so long because people were being very cautious. But many of us in the field really know that these vaccines are some of the best that have ever been developed, and they are the way to reclaim your personal life that's been on hold. And I think that's what we just have to keep sharing that message, and really talking to the general people about the data behind them.
All right, we've got to leave it there. Thank you so much, Dr. Adalja, for helping us make sense of this, because this is really complicated stuff. But appreciate you, breaking it down in simplest terms and helping us understand it. Thank you so much, also, Dr. G, for joining us this morning. Always a pleasure to see you, Dr. Adalja, and hopefully you'll come back and join us again, Dr. G.
Thank you.
Right.
Thank you.
Now, I want to bring on some more doctors, because we're not done with this conversation, because there are lots of issues that have been raised this morning, and that, if you are following this closely, you probably have, like me, a lot of questions about vaccines and about social interactions and this whole notion of resuming your pre-pandemic life. So my next guests are Dr. John Moore. You've seen him on the show many times. He's an immunologist and professor at the Wild School of Medicine at Cornell University Medical School. And also joining us this morning is Dr. Karl Minges. He is the chair of health administration and policy at the University of New Haven. And Dr. Amanda Koontz is a sociologist at the University of Central Florida. She's here as well. Good morning, doctors. Thank you so much. Lots I'm trying to make sense of. We just heard Dr. Adalja, Johns Hopkins scholar, tell us that it's safe, that we can, if we're fully vaccinated, that we can go into public places and take our mask off and feel completely safe. I'll start with you, Dr. Koontz. Why do you think so many people who are fully vaccinated don't feel that safety that Dr. Adalja say we should feel about resuming our normal lives?
I think some of it comes back to what is sometimes called a cultural lag, right? So it took us a good bit to try and convince ourselves to wear masks, not go to certain places, social distance. So we really had to adopt these new norms, develop a new way of seeing things and interacting with others. And we can't make that just simply go away. When we talk about the switch of herd immunity, it's the same thing socially. We created new worlds for ourselves, and I think it's going to take some time to overcome some of the fight and flight responses and to figure out what our new norms are, because we can never go pre-pandemic again. We can't just act like this doesn't happen. So I think it's going to just take some time for everyone to start working together and almost re-socializing back into the world.
Yeah, and Dr. Minges, I know you're a public health expert and you work with vulnerable populations. We know that African Americans and Latinos have been disproportionately impacted by COVID, but we also know that some in those two demographics have some of the highest hesitancy rates around vaccines. And so we're hearing the medical community tell us if you get vaccinated, fully vaccinated, you can resume something, whatever that normal, the new normal is, but you can definitely have more freedom than you had, obviously, pre-vaccination. So why do you think we're still not breaking through with, some of those most vulnerable populations?
Yeah, that's a great point. And it speaks to the disparity of both COVID as well as our vaccination efforts. Really, since Tuskegee and going back generations, frankly, people of marginalized communities have really not thought through the value of a vaccine because of the previous attempts of government saying you should take this vaccine or not. And so that's resulted in a lot of hesitancy for specific groups. And it's very challenging to change that norm, even though generations of my age never really quite experienced that, but it becomes a historical problem. And so that's where we need to be very creative with engaging our community leaders, pastors, and then also thinking about how can we work to deliver the vaccine to places that really need it. Are there unique ways that we can use community like vans or drives? But that's really hard to do with certain populations. Essential workers come to mind, right? Someone might say, I don't want to get the vaccine because if I'm sick, I don't have a sick day to leave, right? That's not an option for me. So there's a lot behind the scenes economically and demographically that's leading to these differences in vaccination rates as well as COVID exposures.
Dr. Moore, I want to ask you about a recent headline. A private school recently said it won't hire anyone who's gotten the vaccine and said, it was discouraging teachers and staff from getting vaccinated and that they would go as far as to take legal action if someone lied about, their vaccine status. How are we ever going to get, the majority of the country vaccinated or a larger, overwhelming majority if we still have private entities, and that was a private school, not a public school, using that kind of junk science and causing its own staff not to get vaccinated?
Yeah, I'd like to persuade the head of that school to test my theory that vaccination enables you to breathe underwater and try it far out at sea. It's just insane, some of the stuff that goes around, but it's part of the dynamic. I mean, we are all agreeing with each other. I mean, I've heard nothing said by all of the guests so far that isn't perfectly soundly, rationally based in the best available science. But, this is a well-educated audience and a well-educated guest set today, and we're all probably pretty liberal in our attitudes. A lot of America isn't like that. And 30% or maybe even more of Americans are going to refuse to be vaccinated. And that is going to be a problem for the rest of our society because it will mean that the virus will not be eliminated from American life in the foreseeable future. It will still be around. It will still have impacts. There is an increasing proportion or probability that we'll develop more resistant and troubling variants the longer the virus. So, we're all in this together as a nation, and yet a significant fraction of Americans have very different attitudes to the rest of us. And we don't interact with them by and large. We have our own social circles that are people who have similar attitudes to us. And so we don't learn the problems that we have to solve. I do have some economic Republican friends on the West Coast, and they've been telling me about the attitudes in their social circle, which is, we are not going to get vaccinated. We do not believe that COVID is real. We do not trust these vaccines. All of the myths that just perpetually circulate. And we have to deal with this. And I think vaccine passports, vaccine certificates are part of the problem. If you want to get a fully, I'm sorry, I think they're part of the solution to this problem. If you want to get your life fully back to normal and engage in as many social activities as you did pre-COVID, then you need to be vaccinated. If you want to go on a cruise, you're going to have to be vaccinated because the cruise lines are starting to impose this as a condition, and one of them is now fighting the governor of Florida, who is trying to ban cruise liners from doing this, but the cruise liners are saying, well, we're going to do this, and if it means we don't visit Florida anymore, so be it. So private industry is going to take a leadership role, and I think that will drive more and more reluctant people to become vaccinated so that they can enjoy all the benefits thereof. But we're going to need to do something like this, because if we don't, there will be a residual pool of virus circulating essentially indefinitely.
Dr. Moore, there are about 32 million Americans who've had COVID, roughly. A lot of those folks we are hearing are saying they don't need to be vaccinated. Many of them are, saying they believe they have the antibodies. We heard Diana talk about, her being tested for her antibodies to see how long they remained in her system. We hear many of them still saying that the science, isn't solid, that the vaccines were rushed. So still a lot of misinformation, but the biggest one being that they don't need it because they've had the virus.
Well, it's true, but only to an extent. I mean, people who had the virus in the initial wave a year ago, their immunity is waning. We know it's waning over time. And people who had only mild COVID and recovered at home with just a few days of inconvenience and not too much seriousness about their disease course, they only developed mild immunity. Protection was assessed last August at around 80%, which is less than the best vaccines. And that was last August. So what is it now? And there are enough examples now of the more troubling variant starting to infect or reinfect people who recovered last year. FDA and CDC recommend vaccination for recovered convalescents. I think that's important, and it will become increasingly important over time. So, it is true to an extent that you have a degree of immunity, but not to the extent that you could achieve by taking the vaccines that you're entitled to. And I strongly recommend all recovered convalescents to follow FDA and CDC guidelines.
Dr. Minges, how do we get people, particularly, marginalized communities, one of the biggest hesitancy, one of the points that we often hear about why they're not getting vaccinated is this notion that this was rushed. Operation Warp Speed, perhaps the worst name ever for this program, but they don't necessarily, and I've said to people, well, are you asking the same questions about the timelines for the development of other medication that you're taking? I don't think people are doing this deep dive asking, that insulin that maybe I'm taking for diabetes, how long did it take for it to get FDA approval? But yet with the vaccine, there seems to be this hyper focus on this concept that it's new, that it's novel. How do we combat that?
Yeah, so part of I think the conversation is understanding that there's, various ways that we can address the different types of vaccinations that we have available, right? So we have the mRNA, which is sort of new to a lot of people. That technique is a little unusual. Then there's the adenovirus version, such as the Johnson & Johnson vaccine. So really what we have to do is just educate the population, create health promotion messages from leaders in the community, people who look like them, who speak like them, who know the same languages, and do what they can to really advocate for vaccinations in this population. There should be incentives too, right? States have gone pretty creative with especially younger populations getting them vaccinated. Maybe those need to be tailored a little bit to people of diverse race ethnicity.
Do you think states should pay? I know a lot of employers are giving people a day off. They're giving them $25 gift cards. Do you think states should go into marginalized populations and offer, I don't know, $50 gift card or some other kind of financial incentive?
You're seeing that in some states. Even West Virginia has a sort of $100 savings bond that they're giving younger adults under, I believe, age 35 to get vaccinated. It's a really creative approach to generate interest. I would say, why don't you go through a mechanism where if you get vaccinated, you get $25. If you bring your friend with you, you get another $25, right? So how can we make this a community building effort to really reach these populations? I think you could be creative with your solutions.
Do you see any downside to offering cash incentives for getting vaccinated?
Nope, not at this point. I mean, we are at a point where the vaccine rate in the States is roughly a third are fully vaccinated and about 45% have at least one shot, and that's slowing down. And these communities are the most at risk in terms of getting COVID, spreading COVID. The implications of COVID financially are also devastating. So I think doing whatever we can to get shots in arms is the most appropriate steps forward.
So, Dr. Koontz, so we have this country now that's divided. We have those of us who've been vaccinated, those people who say they will never get vaccinated, and then you have this kind of middle group that's saying, well, I'm going to wait. I'm going to give it more time. I'm not totally against it, but right now I'm not going to do it. And we have things opening up. We talked about bars, sporting events, private, family functions. Can you see there being situations where just as we're going to have this divided country, the vaccinated folks and the non-vaccinated folks, and unfortunately we may have more minority people falling into that non-vaccinated and having this kind of second-class citizen status. How do we manage through that, both on a public level, going into a club, where people are saying, I don't want to go unless I know everyone else is vaccinated. And then even navigating with your family function. You're going to have a barbecue. Do you tell family only the vaccinated folks are invited? Help us as a sociologist, because this is going to be some thorny questions and potentially lots of family feuds that are going to happen over this vaccination.
Yeah, I think some of the family feuds started a little bit earlier in the pandemic also. I mean, we've had some divisions already discussing even whether people would wear masks or not. We heard somebody already talk about how contentious it was. And I think so much has been based in framing. So everything has been politicized. And that makes it seem as though there is a right and a wrong. And you can find information to back that up. And so I think the more, and Carl was already discussing this some, like, I think the more that we can start tailoring information, and not in a manipulative way, not a means of propaganda, but instead to say, here's why this matters to you. So even when we talk about the younger population who's very hesitant, who might say, well, I'm still in the invincible mode. I haven't quite gotten to that place where I realize that these things affect me. Start connecting with these groups in that way. And the more that we can learn how to frame and talk to each other, then not only can this be a public push, but also this is how we can connect with each other as humans, not as this camp or anti or for, but as—
Well, let me ask you this on a practical matter, Dr. Koontz. Do you think there should be this separation? You heard Dr. Adalja talk about it, and Dr. G said it's already starting to happen. Do you think we should have vaccinated only sections at public places and even in our own family gatherings?
I think there's a certain form of logic to it when it comes to physical health, and also just when it comes to the mental strain that it takes to move around at this point in time. Yet our country, just being realistic, our country also is rather individualistic, and that has been a concern from the get-go. To start forming these divisions, I think a focus from the get-go has been liberty, freedom, things of that sort. I think a lot of people will push back on this. And so I think that it could end up in the long run causing greater division and actually people potentially digging in their heels because of where they are going to take a stand on.
But let me ask you, how valid are these liberty arguments? Let's be real about the government. If you get in a car, the government is dictating what you can and cannot do in that car. You must wear a seatbelt in that car. You must drive it at certain speed limits. If you are not 21, you cannot buy liquor in this country. So this notion that I have some liberties around this vaccine that are different than, the freedoms that are abridged every day by our government. I just don't, I think they're kind of bogus, to be honest with you. I'm not buying it because the government dictates, pretty much every aspect of our lives already. So why call this out as some separate, infringement on rights when there are so many other ways that the government, imposes itself into the lives of everybody that lives in this country?
Oh, there can seem to be a form of hypocrisy in the way that certain things act as though it's outside of this discourse, but it's, for the most part, it's how it's been hedged and how the conversation started. We already had issues with vaccination and anti-vaxxers, and when that discourse gets going, it picks up momentum, and then it creates a rhetoric around it. And once that gets picked up, then, as I mentioned, it gets politicized. And so if the
But I understand that, but I guess what I'm asking is, and maybe Dr. Moore, you can jump in too, should we be pushing back on that? Should we just reject wholeheartedly this notion that somehow the vaccine is an infringement on your liberties in a way that all of these other things that the government does, from driver's license to speed limits, is not? I don't know, as a country, should we be buying into that and giving that credence? Because I don't think it deserves any credence. And you're an immunologist. People get Botox and butt injections and all kinds of other, chemicals they put into their bodies, but somehow the vaccine is being, demonized.
Yeah, I've recently written about this in an editorial, and I strongly agree with what you say. There are many constraints that are imposed on our lives that we accept. Even in open carry states, you can't take a gun into a bar where alcohol is served, and that's a very sensible public health precaution. You can't smoke in a bar, but you can go in a bar without being vaccinated, which is a significant risk to other people around you. So there are all sorts of constraints. Freedom isn't free. We accept conditions for being members of a complicated society where we're dependent on the actions of others, and our actions influence other people. Yes, America is polarized, and yes, vaccines are going to further polarize America. That's not going to be solved overnight. A significant fraction of Americans will never be vaccinated based on their own personal beliefs, whatever they may be. But there is a significant fraction of people who are persuadable.
Well, let me ask you this, Dr. Moore. That portion that is deciding not to be vaccinated, should they suffer some consequences? And I don't mean suffer in a negative way, but I mean, should there be consequences like the smokers? If you choose to smoke in this country, you don't have a right, as you said, to smoke in a bar, to smoke in a restaurant, to smoke on an airplane. Now, you can still smoke, you just got to figure out other places to do it that don't allow you to spread secondhand smoke to other people. So should we be saying to people who won't get vaccinated, you have a right not to get vaccinated, but you don't have a right to get on this airplane. You don't have a right to to come into this restaurant or into this public space where you could potentially be a danger to other people.
Yeah, I think that's the right attitude. It's certainly the right attitude to me, that there are consequences you're going to have to live with for refusing to be vaccinated in a complicated society where other people are affected by your actions. And this, I don't think, will come from the government, and it probably would make matters worse if it did, but private industry is already moving in this area. And if all of the leading American airlines said, you're not getting on a plane unless you put in a bona fide vaccine certificate alongside your boarding pass, then that would have a huge impact. You want to go from California to New York? Rent a car, get driving. You can still go, but you have a penalty. I mean, a Republican state senator in Alaska was recently banned from Alaska Airlines for refusing to comply with mask-wearing policies. Now she has a 14-hour drive and ferry ride via Canada to get to the state capital to go and fulfill her constitutional duties.
Yeah.
Well, she can still get to Juneau, but it's pretty inconvenient. And
yeah. No, and that's right. I think you have constitutional rights, but you don't have you don't have a right to get on an airplane. That's not a constitutional right. You have a right to move about the country freely, but it doesn't mean you have to be able to fly on an airplane. I'm running out of time, but I do want to ask you, Dr. Minges, about children. We're hearing a lot about children. And again, when I think about marginalized populations, sometimes multi-generational households where kids are coming home to those families, and maybe a grandma and a grandpa and several other generations in that house. Are we sending the right message about kids and whether they are potentially at risk or not at risk? Because it seems like there's this notion that kids are fine, we don't have to worry about them. But are we leaving out or missing the part of that where they are going home, particularly in certain communities, into crowded households with adults?
Yeah, I'm glad you brought that up. I think kids have largely been forgotten in much of this conversation. And that's partially because the vaccines really weren't tested in those under age of 16. Fortunately, now they are reaching that population. There's lots of trials. We would expect some type of a vaccine in the fall, but until that point, I think it's still important to start engaging in mask wearing in crowded places. And even if the risk is small, you could still spread it to your child. And we don't know what the long-term repercussions are from even a mild or an asymptomatic exposure and symptoms for a child. So absolutely, children are living in environments where they have multiple caretakers, are living in close quarters in some communities, and can very easily spread it to another child. So absolutely, children need to be on the forefront. And this is why masks are going to be still part of our culture for the next several months. I don't see a situation in which it's prudent to say, take off the mask.
So you would agree with the CDC guidelines about summer camp? You think those are prudent guidelines, that kids should wear masks, that they should socially distance even in summer camp settings?
Absolutely. And absolutely in schools, once they get back in session, transmission is quite rare in the right circumstances. So absolutely mask wearing until vaccines are available. But then that's another challenge, right? Only about a third of the population of parents are saying that they will vaccinate their children at this point. So there's another public health messaging campaign for you.
I'll give you the last comment, Dr. Koontz, and it's about this whole personal risk calculus. And Dr. Adalja talked a lot about it because we just heard Dr. Minges say, keep wearing those masks. Dr. Adalja 10 minutes ago said, take those masks off if you're clearly vaccinated. So I don't know if I've created clarity or confusion today, but I think it all is going to boil down to, in some ways, your own personal risk calculus. And as a sociologist, help us understand how we should be making that calculation.
Right. And I think that's something that has made us pretty tired lately, is that we've had to do a lot of risk calculation. So I would definitely say taking into account the knowledge that you have, right? The knowledge of your own health, your family's health, and the circles that you travel within. And I would say that as you take that in, also what you were mentioning about these other components, go ahead and do your own homework. But look at multiple sources. Don't just take in one, don't just pick and choose. Look across multiple sources and then apply it to your life, because this is such an intersectional issue that it will still be needed for people to go ahead and do their homework and make their own decisions about what they're willing to do and balancing mental health and physical health all at the same time.
Yeah, no, I think that's an excellent point. Do your homework and make your own decision about what's best for you. Thank you so much, Dr. Koontz. Thank you, Dr. Minges. Always great to see you, Dr. Moore. Again, I'm not sure if we answered everyone's question, but at least we gave them something to think about, and we gave them one more source that they can turn to. As Dr. Koontz say, check multiple sources, and that's what we want to be here at the Special Report, is a source of trusted information with some of the nation's leading experts on these really complex issues. So again, thank you all for joining me this morning.
Yes, thank you.
Yeah.
All right. Thanks again to all of my guests, and thanks to you for joining us. Boy, this is a complicated subject, and as we, try to move back to this pre-pandemic life, do we do it with masks? Do we do it with social distancing? And, do we have family over that aren't vaccinated? Do we go into bars? Do we go into clubs? I think Dr. Koontz put it best when she said we've got to do our homework. I think of this the way I thought of autism when I was doing research for my son, trying to make the best decisions for Marty. And people would send me articles about what some other family was doing across the country, and telling me, "Oh, have you tried this for Marty? Have you tried that for Marty?" And what I settled in for myself, and what I taught others as an advocate, an autism advocate, was this is such an individual decision, and you do have to follow the science, but that science has to be incorporated into everything that about your own child, about your own life. And likewise with COVID, as we're not out of COVID, but obviously we're turning the corner. We have to take into consideration what the science says, and that science is coming from different doctors, because you saw even on this program this morning, some of the nation's leading doctors, and they didn't all agree. And they're not going to all agree. And if you watch 3 or 4 different news stations, you're probably going to get 5 or 6 other opinions, many of them contradicting each other. So this is a situation where you're going to have to be on your P's and Q's. You have to do your own homework. You're going to have to know your own family's history. And you're going to have to make good decisions based on the information that you learn from these experts, and that what makes the best sense for you and your family. All right, some words to live by before I get out. It's a brand new day, people. Let's not F it up. And I mean that with all sincerity. We are turning the corner on this virus, and there is much to celebrate. Last week, 33 states reported a decrease in the number of cases. And as we heard these experts say, we are flattening the curve, but we can screw this up. And we can screw this up by not taking seriously what we need to do to completely turn the corner, and that is continue to be safe, to continue to get vaccinated, and to wear the mask in these situations where the CDC says we should be wearing masks, and to socially distance, again, in those situations where the CDC says it's appropriate. I know it's frustrating. I wish I had clearer answers. I wish I could, make it black and white. As a lawyer, I love for things to be black and white. I don't like the gray area. I like to be able to tell folks, hey, this is it, and just follow But this is not one of those situations because this virus is something the likes of which we've never seen in this country and in this world. And we have to be patient and recognize that the scientists are running as fast as they can. They're getting us the information as quickly as they can. We have to trust institutions like the FDA, like the CDC, like the Biden administration, because we know these are all really super smart people who are working in our best interest. We're not going to always agree with them, and that's okay because as smart people, we don't have to always agree. But we do have to follow the scientists. And I just say, find those reliable and trusted sources. The special report is one of them. And find other sources that you can trust and that you can rely on to make good decisions for your family and for your community and for even folks that you don't know, your coworkers, folks that you meet in a bar, folks that you may meet in a stadium, because we want to keep everybody safe. And I believe we can get back to something that looks like normal, where we can enjoy each other, we can hug each other, we can touch each other, we can be around each other. We just have to be patient and we have to follow the science. And what we do know is that if we all come together and work together, it will then truly be a brand new day. I'm out, y'all. Be safe out there. Wear your mask, at least indoors for now. And remember, we are all in this together.